Welcome to Field Notes, Insights from N2PH Health Alumni. N2PH Health is a year-long workforce training program for those who are new into the field of public health. I'm Juliana Mansky.
And I'm Mackenzie Legal. We are program facilitators and hosts of this podcast. With a vibrant community of over 400 current and past residents, New to Public Health is a wealth of knowledge and experience in the public health field.
In each episode, we'll share inspiring stories and valuable insights from those who've journeyed into public health, highlighting their unique path and the impact they're making. Joining us today is Andrea Tofte, Public Health Educator and Emergency Preparedness Coordinator from the Cook County Public Health and Human Services in Minnesota. Andrea graduated from the New to Public Health Residency Program in December 2023. Andrea, thank you so much for being with us today. Would you start by telling us more about what inspired you to work in public health?
Hi, Juliana. Thanks so much for inviting me. Well, my path to public health wasn't a straight line. I have a background in environmental engineering and environmental sciences. Um, and I had a strong interest on how our environment shapes our human health. So when I moved to Cook County, which is in northeastern Minnesota, it's a beautiful country, but it's also a rural, remote frontier community. Um, I moved in here right on 2019 before the pandemic started, and as that evolved or developed, um, I I thought it was like my opportunity to step in and see how I could support in that response. And so that's kind of how my career started.
Oh, very interesting. So now that you've been with the county for a couple of years, what type of work do you do today? And give us some examples of what you do.
So after the first year and a half that I was doing essentially COVID-19 response that was focused on education and vaccine coordination, liaison with the school. I supported them with testing for COVID-19 when we were in that phase, and with a lot of education with the parents and the students on how to care for them and for others. And so, anyways, um, after some time being there as a part-time temporary staff, the county opened a new position, and they added a spot for public health, and then that's when they offered me a spot for a full-time staff. And since it's been 3 years now that I've been full-time working, and then my main programs that I coordinate are the Healthy Home Program. I'm also the Emergency Preparedness Coordinator and the DPNC, which is Disease Prevention and Control Coordinator. So with that, I have communication with the schools. I support with vaccination campaign, education, and also with emergency preparedness in response for any of the threats that face that our community faces here.
Yeah, that is so much. And thank you for your service, especially entering public health right at the start of the pandemic and looking to see how you can help in that. I'm sure that experience has really made you a stronger emergency preparedness coordinator in anticipating what could happen and how to prevent emergencies or how to mitigate emergencies when they happen in the future. I am especially interested in hearing more about the Healthy Homes Project. Would you tell us a little bit more about what that program is?
Yeah, thanks. Healthy home programs comes from oh, is developed after the community health assessment for the last two cycles, and this is something that gets done in a community every 5 years. Um, it has come housing as a priority area because of a few factors. There is a very low availability for housing. We don't have a middle housing or transitional housing or long-term care facilities. Our population is 30% represented by people 65 and older, and many of them might have lived for an entire life in their homes, and they're kind of deteriorated. The weatherization needs to be improved, and then they also need some modifications for them to be able to age in place, since we don't have many of those facilities to where they can transition from their home. Um, our program comes kind of with that lens to support them and see how can we improve their housing based on the home hazards. So we look for anything that can be potentially cause a fall or be a fire risk, or there is some insulation or leak of heat or moisture accumulation, possible mold. Um, and so we come with this program, and it was developed after finding, the need, but with applying for a grant for MDH that also partners with the HUD for this training and funding for us to implement this. So we have had the grant two cycles, and now that we're on our second cycle, I'm coordinating this grant, and our goal is to assess 40 homes in the 2-year cycle period that we have the grant for.
That is excellent. I think that's so important to be able to connect with those individuals and help them stay in their home, should that be what they want to be, and really prevent some of those injuries that could be prevented by taking away throw rugs or helping maintain the home, whatever those creative solutions might be. Do you have any community partners that help you with this Healthy Homes project?
That's a great question, and we have been able to have this program going and being successful because it was a part of a collaborative effort of different agencies, including the Cook County Housing Redevelopment Authority, the City of Grand Marais, Care Partners, the Veterans Services, Cook County Social Services, Grand Portage Health Services, Cook County Energy Project. So with all of these partners, we meet, create a network called Healthy Home Network. We develop a resource list, and with all the services that can help home rehabilitation. And also through the HRA, they were able to leverage more funding. So because the Healthy Home Program can only allocate $750 for mitigations in a home. With the HRA, we can bump it up to 5,000 per home. So with that, we can do projects that are looking to preserve the home, envelope projects that are trying to do energy consumption and reduction or optimization. So with insulation or anything related to that. So it's been great. Many this far We have been able to complete 5 projects, and we have 6 more in the books, and we're hoping that more and more funds can be leveraged to continue supporting these home rehabilitation and aging in place projects so we can support everyone to have a healthy life, and especially our older adults to age in place.
That is absolutely wonderful, and how you've been able to work with various partners, really strengthen your capacity and um, expand on what you can do for these individuals, having a stronger partnership, and really looking at that like community resilience, and creating that support system for them to stay in their homes and live healthy as people age. You mentioned some resources, and as a graduate of the New to Public Health residency program, I'm wondering if any of the ideas to build new partnerships, creative partnerships, or resources have helped you, or have you learned any of those resources that you can now apply to the work that you're doing for Cook County?
Yeah, definitely. I think um, going through the New to Public Health program was like a turning point for me in my career. It gave me lots of confidence when to know what I'm talking about. It helped me to understand the context and the foundation. We did through the different modules that we went through. I understood about coalitions, more working with partners, how to work with partners, how to focus our message and align with our goals with actionable items, measurable, uh, look for quality, but also for impactful results. I think being in the live sessions and taking those opportunities to interact on those small rooms with the other participants of the program or colleagues of public health. It was so enriching for me. Like I mentioned earlier, I have a master's degree in environmental sciences, and I did enjoy so much taking that when I was going to school through that, but it's on a very different lens. So being able to have formal education with peers that are pursuing this education in this path and learning from them, that definitely has helped me um, shape my own public health profile, and um, makes me feel like I there's so much more to learn, and so many great people out there to learn from and collaborate with.
Well, I'm really glad to hear that New to Public Health has been able to provide you with that larger scope of public health, and that you were able to identify new resources from the online course and those discussions and what you've learned from networking with others in your cohort, um, and then being able to apply them to your work, and really be able to further support and more strongly support the people of Cook County. So, as we wrap up, are there any other lessons learned or insights that you would like to share that others might be able to apply to their community in the realm of environmental health, healthy aging, healthy homes, in your or anything in your area of expertise?
Well, I would say that one of the things I like to highlight is like the rural communities have like a unique strength. There is like so much social connections and social ties that are willing to pitch in to make some changes happen. And even small steps have very high impact. So fixing little things like a leak, removing old carpet, or changing smoke detectors can impact in someone's health and build trust, and let people know that also lets people know that we care, and that public health is something that we can all build together in a community.
Is a beautiful sentiment and so true. Andrea, thank you so much for joining us today, sharing your story into public health, and especially for the work you do on the Cook County Healthy Homes Project. You are an inspiration and such a leader in your community, and we very much appreciate your time and service to the people of Cook County.
Thank you for listening to Field Notes, Insights from New to Public Health Alumni. For more information, visit new2publichealth.wisc.edu.